October is Breast Cancer Awareness Month, and today we're at Advanced Medicine in Johnson City. I'm joined by Brooke Bentley, Dr. Dave Marden. Brooke, you're very passionate about this. In fact, you just sponsored a very special event.
I did. It was a little pink dress event, and we got to celebrate the survivors' lives, and so it was a wonderful event.
Talk to us about some of the stats. I mean, it's the same locally, nationwide, as far as breast cancer is concerned.
Yes, it's very common. About 1 in 8 women will develop breast cancer within their lifetime.
What are some of the signs and symptoms that ladies can be on the lookout for?
Some common things that they can look for when they're doing their self-breast exams is any kind of change in the texture of the skin, any kind of nipple tenderness or discharge or change in the shape, and then lumps, of course.
When you find a question like that, you send it up the road to Dr. Marden here at Embrace Gynecology. And doctor, when she does send a patient to you, it's important to get that testing started early. Early detection is the key, isn't it?
Absolutely. The smaller you detect it, the better. The guidelines have shifted and changed over the years and can be somewhat problematic even for the providers. Some are suggesting as early as 40, some are waiting till 45. But again, working with your provider and finding out what is best for you based on your risk factors is key.
And you are also mentioning hormones. If anyone is on hormones, it's very important to maybe even start that earlier.
Absolutely. Hormones pose another risk factor, although hormones actually don't pose risk factors any higher than being left-handed or having a college education as far as increasing your risk. However, it is a risk factor, and adding that to that person's other risk factors kind of creates the way we would approach how often to screen them.
And we hear excuses all the time. You hear excuses from your patients. There's really no good excuse for not getting a mammogram and not seeking that early detection, is there?
Absolutely. As we were talking, the worst excuse I hear is I'm afraid that you'll find something. And that's the biggest fear I have, is that we had the opportunity to find something very early and cure them. With 9 out of 10 women surviving breast cancer these days when found early, gosh, it's very important that they get on that early.
All right, Dr. Marden, Brooke, thank you so much. There is so much to say on this subject, but the key thing is early detection, and a great place to get started is right here at Advanced Medicine here in Johnson City.
The preceding portion of Daytime was sponsored by